Despite the apparent spread of the UK COVID-19 variant in certain parts of the country, the Health Department sees no need to impose stricter protocols than what we have right now. To explain this further, we have Greg Gregorio reporting to us live from Mandaluyong. Greg, good afternoon. Did the Health Undersecretary explain precisely why there's no need to tighten protocols at the moment?
Good afternoon, Charles. According to Health Undersecretary Maria Rosario Vergere, what we have to do now is to implement properly the existing protocols that we have, including the granular lockdown that is allowed to do by the local government units, depending on the COVID-19 situation in the country, depending on the COVID-19 situation in their locality. And apart from that, what we have to do is to follow properly the minimum public health standards that the government and experts have been telling all of us to do, like the use of face mask, face shield, hand sanitizing, and following of physical distancing. Charles?
All right, so much for the minimum health protocols that are already in place, but then could you tell us about this 2-week mandatory quarantine for residents who will be coming from abroad? Will the DOH be extending this?
Charles, according to Vergere, there are no decisions yet on whether it has to be extended, but this will be depending on the decision of the IATF if they will see fit. For now, what is in place is that if a person arrives from abroad, this patient or this person would have to undergo 2 PCR tests on first on the first day of his arrival and the 5th day of his quarantine. If he tests negative on the 5th day, then he would have to finish 14-day quarantine in his LGU. Charles?
Right, so that protocol is in place, but then if not stricter protocols and longer quarantine periods, what does the department have stored to arrest the further spread of this UK variant? No alarm bells just yet, no?
Yes, Charles. So, well, aside from this quarantine protocols, the contact tracing efforts are strengthened in order to locate the possible close contacts of our UK variant case, of our recorded UK variant cases, to know as to how much is the extent of the existence of this UK variant in the Philippines. Charles?
All right, Greg, talking about close contacts, the DOH has said that the close contacts of the 12 UK variant patients in Bontoc have all been identified and tested. How many of them tested positive?
Charles, as to the 12 UK variant cases in Bontoc, 144 close contacts have been identified. 116 from this have been subjected to RT-PCR tests, and they found out that 34 are positive to COVID-19. However, they are yet to be subjected to genome sequencing to determine if they also have the UK variant. Charles?
All right, that's something to look out for. But then tell us about the Health Department's reaction to certain speculations that LGUs may be actually concealing their true case counts in their respective areas. What do we have on this?
Charles, according to Undersecretary Vergere, if this is indeed true, then they are giving warning to the local government units that if cases are untraced, local or undetected, and if their close contacts are untraced, then it would have to mean that our data is incomplete. If our data is incomplete, then we cannot have enough basis for a proper response as to fight this pandemic that we are facing. Charles?
All right, then hopefully the data comes in as quickly as possible. Let's talk about the Philippine Red Cross, who are starting their saliva tests today. What is the latest on this new method of testing? Who can conduct this, and how effective is this compared to the usual swab test?
Charles, well, let's clarify that saliva testing would only mean that instead of swab specimens, the tester or the one who will conduct the RT-PCR test would get saliva from an individual as specimen that would still undergo RT-PCR tests, as it is still the gold standard for detection of SARS-CoV-2 infection. Now, according to Vergere, after the Philippine Red Cross has presented their results, the result of their study to the Department of Health, their lab experts has approved this, but as of now, the use of saliva testing for RT-PCR tests could only be used among Philippine Red Cross laboratories, because we still have to wait for the independent or the own study that is being conducted by the RATM before this can be used, before this can be widely used in the country. Charles?
Right, Greg, I have just one more question before I let you go. Moving back now to the new UK variant, do we know of any new cases aside from the 16 that we reported earlier?
Charles, as of now, there are no new recorded UK variant cases in the country. But according to the close contacts that is, according to the contact tracing that is being done by the Department of Health, as I've said earlier, there are 34 positive COVID-19 patients among the close contacts of the 12 UK variant cases in Bondok that have to be subjected to genome sequencing. Apart from that, there are 4 positive cases among the close contacts of the UK variant case in La Trinidad. And apart from that, there's also a weekly weekly release of genome sequencing conducted by the Philippine Genome Center. I guess we have to wait for the result of the 3rd batch, maybe at the end of this week. Charles?
Right, thank you, Greg Gregorio, reporting live from Mandaluyong.